or heat. My name is Stephanie, and I'm excited to spend a little time with you all here today to talk about these two modalities that can help us feel better and recover. During this session here today, I'm going to ask that you would please make sure that you stay on mute during the call. After our time here together, we should have enough time to take ourselves off mute or to use the chat box to ask any further questions. I am recording this session today, and after our call, you will have access to a link in the chat box of this meeting invite, so you can review this link for the future. And then also afterwards, I'm going to launch a poll. If you would, please share a little bit of feedback about your experience with this session. On that note, this session is educational in content only and is not intended to provide medical advice. If you do have a medical concern, we encourage you to seek out medical professionals to advise you any further. Let's go ahead and dive in. Right. So again, if we haven't met, I do see actually a lot of familiar faces on the call, which is always so wonderful. But we haven't met yet. I'll introduce myself. My name is Stephanie Brunson, and I have been working in the health and fitness industry for over 15 years now. I started my education at the University of Houston in Clear Lake, and my degree is in fitness and human performance. I became a yoga instructor, personal trainer, and movement specialist, and worked as an instructor, teacher, trainer throughout that time. Most recently in my career, within the past 5 years, I've moved into the ergonomics field. And I started working with what we consider industrial athletes, corporate athletes. And so some of the industrial athletes that I've worked with have been in manufacturing and distribution sites, and now I am working with our office workers here at HPE. I also have an advanced ergonomic certification from University of Colorado, and if you were on the call a little earlier, Colorado is one of my favorite places in the world. All right, so that's a little bit about me. Let's go ahead and start learning about ice or heat. So the first slide here is kind of a fun little slide to see where our knowledge lies with these two modalities. So since heat is more relaxing and soothing than ice, it is usually the best choice for treating a new condition. Feel free to type in the chat box if you have an idea if this is true or false. False, all right. Wonderful. Thanks everyone for providing your answers there in the chat. So wonderful to see. Let's see what our answer is. That is correct, false. So typically when we have a new condition, we want to think about icing that condition first. We're going to dig in a little bit more to the why behind that, but it's great to see most of those answers were false. Right, so let's talk about why we should be using ice for new conditions. So ice, and another term for ice is cryotherapy. We should be using our ice modality within the first 48 to 72 hours of an onset of a new condition for us. So ice can be helpful to reduce blood flow and inflammation. It's going to help to decrease, so inflammation actually increases the tissue temperature, and it will lead to swelling, redness, pain, and we'll start experiencing a reduced range of motion. So if we have an injury that happens, that's what we're going to start to experience. And ice can come in to help reduce that blood flow and slow down that inflammation that is kind of rushing into that area. Ice can also help to reduce soreness and discomfort, and it can also help to limit bruising and swelling that we may be experiencing within that first 48 to 72 hours of an injury. So cold actually helps to decrease cellular metabolism, and it reduces the body's natural inflammatory response. So when we have deep cooling, it can help to temporarily inhibit that muscle function. So kind of thinking about slowing things down and making things kind of rest right where they are. So when we're using ice, we also want to kind of think about resting. So if you have twisted or sprained your ankle, you want to think about sitting down and resting and placing that ice on the area. So we want to avoid any exercise, we want to avoid exercise, and we want to avoid any weight bearing to that area or joint, and also any complex movement. That's going to help to avoid any further risk as well. So when we're icing, we're also resting. Let's talk a little bit about heat. So when we want to start incorporating heat or thermotherapy, that's going to be after that 48 to 72 hours. So heat is going to start to increase the blood flow to that area. And this is not recommended for a brand new condition when we're already experiencing inflammation in that area, right? If we have a new condition, our body's natural response is to start heating up that area and increasing blood flow naturally. So we don't want to kind of speed that process up. So that's why we're delaying the use of heat. Heat is going to also help to aid relaxing those tight muscles and any achy joints that we might have. So it's going to help to relax the muscles in that area. And then heat is also a wonderful modality to incorporate consistently for an older condition that you might have, or if you have a condition like arthritis. So again, the use of heat is intended to kind of loosen up the tissues and help to kind of increase our ability to move the joint safely, okay? All right, so now we're going to kind of practice with a little bit of our knowledge of when we're using ice or heat, and this is when we can use the chat box as well. All right, so we have our first scenario. John feels some discomfort in the back of his right thigh. He recalls that it started when he was working on a production line. It was at the beginning of the day, and he kind of thought that it would go away at the end of the day. But 4 hours into his shift, he's still feeling that discomfort. So if you were a coworker of his and he was explaining this to you, what would be a recommendation you would offer? Seeing some ice come through. Ice and rest. Wonderful to see. Right, let's check. Right, so we want to think about ice. So again, this is a new condition. We call that acute, and it's still within that 48 to 72 hour window when we want to incorporate ice. And I would also encourage him to rest. So if he can go take a little break, rest, ice, he's going to start to feel a little bit better. All right, let's try for round 2 here. So we have our next scenario. We have Ramon. Ramon reports discomfort in his upper neck. It's mostly on the left side. It's been on and off for about 10 days and generally doesn't bother him during work, but he feels the stiffness when he's waking up before starting work. So what are the guesses here? Wonderful. Right. Yes. Really great. Great answers here. I am seeing heat, and that is the correct answer. So Ramon is feeling discomfort for a few days now, so it's not new to him. It feels stiff when he's waking up at the beginning of his workday. And so, yeah, I would encourage him to use some heat and also maybe some foam rolling, rolling out the shoulders. And yeah, Isabella, I agree. After 10 days, that's kind of a while to be feeling discomfort. It would be time to seek out some medical professional to see if there's something else maybe going on. So yes, heat at the beginning of our workday, and I like to think about heat and ice kind of like we do when we're working out, right? At the beginning of our workout, we are heating up the muscles, right? We're preparing them to move. We want to increase the blood flow to the areas. We want to wake up the joints, right? And so if we're incorporating heat at the beginning of our day, that can help us. And then when we're kind of moving towards the end of the day and we're slowing down and we're finding more rest, ice can be helpful. All right, we have another scenario that we're going to look at here together. And this is one that we probably see more often, especially in my day-to-day experience. Stephanie, who spends much of her day sitting at a desk, is experiencing some minor or low back discomfort. She's dealt with it on and off for a couple years now, and she's seen an orthopedic doctor and has received physical therapy. Stephanie now feels that her symptoms are coming back to her. So what do we think if we were just a coworker, we were hearing this and we're like, hey, this is an idea to try. What would you suggest? Yeah. Love the move more. That's always my answer. Thank you, Nasser. Yep. Really wonderful answers in here. Let's look at the answer we have here together. So this is kind of a tricky question, but you all are responding great to this. So in general, the recommendation again would be to kind of heat up before activity and to ice after activity, right? So if we think about our workday, having like a heating pad, incorporating more movement, making sure that she's not sitting and staying in one area for too long, that's going to be helpful. And then as she comes to the end of the day, using an ice pack or something like that and resting is going to be helpful to recovering from the work of the day. So again, movement is powerful, and movement's also going to help to keep the heat, the natural heat in the body there when we need it. Really wonderful answers. Yep, CubeFit, great answer, great answer. All right, so let's talk a little bit about how we use ice. So when we use ice, how long and how often? And ice is typically not the fun one that we really love to use, but it's important, as you can see and as what we talked about. So when we're thinking about icing, we want to think about what the location looks like. So if you're icing something like your finger, there's not a lot of tissue around this finger. It's pretty, we can get into that joint and those muscles pretty quickly, right? So icing for 3 to 5 minutes is going to be plenty of time. But when we think about larger areas or areas that have deeper tissue, so like our back, shoulders, hips, that time frame is going to be a little bit longer because we're going to need the ice to sit there to kind of get into that area, okay? So it's just dependent on what area you're using. Now, some options for ice as a modality, we have ice packs. You can make a bag of ice with ice cubes and some water. They have gel packs that we can use. Frozen veggies are always that really great go-to that helps to kind of like surround the joint. I think it's great for like knees and elbows, right? There's also ice massage. So there are these cool little like it's like a little ball or a roller device, and you can put it in the fridge, you can put it in the freezer, and then you can kind of roll it on the area. And then also ice baths. So you can, if your whole foot is really bothering you, you can fill up the bathtub with some water and dump some ice in there and kind of submerge it. Now, some things to think about when we're using ice. Again, it's not typically the most preferred one because it's not a normal feeling to kind of ice something. And there's a progression of sensations that you're going to feel that is normal. So you're first going to feel cold, then you'll feel burning, then you'll feel aching, and then you'll get to kind of this numbness. And a lot of times we are tempted to kind of pull that ice off the area when we're in that second phase. So we get past the cold and then we start to feel that burning, and it's our instinct to pull it away. But if you pull it away too fast, then you really haven't targeted that tissue that you need to. So if you can, try to get to that place where you can get past the burning into that kind of aching feeling, and then that numbness feeling where it really relaxes and you're decreasing the temperature of the tissue. That's correct, George. We don't want to have direct contact with our skin. We want to protect ourselves. And so using a towel in between the ice is going to be incredibly helpful. We don't want to have ice directly on our skin. All right, so again, here's the precautions, and we'll talk a little bit more about what we want to think about when we're using ice. So anytime we're using ice, we don't want to use it immediately before physical activity. Remember, anytime we are starting our day or we're starting a workout or work, we want to be warming up, right? Not cooling down. So do not use ice immediately before. It's going to limit our range of motion. It's going to increase our risk of injury as well. Don't place ice or ice packs directly on your skin. Again, we want to have an insulating layer to protect the skin tissue. Any area that is numb or has an open wound. And there are certain medical conditions we want to consider when we're using ice. So ice or cold therapy for elderly individuals, they typically have a decreased circulation already. Any individuals with diabetes, neuropathy, complex regional pain syndrome, or Raynaud's disease, these individuals are going to be at a greater risk for what we call ice burn. And so we want to think about less intense options or more insulating layers for them. And then also, if you have had a history of like a frostbite or a cold injury in the past, we want to try to avoid using cold as that modality. Okay, let's look a little bit of, let's look at heat and how we're using heat. So again, when we're warming up the body to promote circulation, increase blood flow to areas, we want to think about active warm-ups. So anytime we are fixing to prepare our body to move is when we're using heat. After the first 48 to 72 hours of an injury, and we also want to incorporate mild exercise, some stretching to that area, that's going to help. And then depending on the individual or situation is going to be how long. So it's just kind of up to you how long you feel comfortable with using that heat. And as far as options go, we have lots of those as well. So we can use heat wraps that you put in the microwave and heat up. You can also use those electric heating pads, warm gel packs, and a warm bath or shower can also be a great way to warm up the body and the tissues. Some precautions to consider. We do not want to use this after our physical activity, right? So using caution with those open wounds, using it after physical activity, any areas that are numb, and if we have a fever or if there's evidence of infection, we don't really want to be increasing blood flow or increasing our temperature there. Our body is naturally trying to do that already. And then reintroducing activity very gradually and progressively if we have had an injury and we're in that 42 to 78 hours afterwards and we're using heat, really think about gradually increasing the weight bearing, gradually increasing the movement to the area, and again, as the area tolerates that new movement. So we also want to use precaution to prevent burns. So if the temperature is too much, again, we want to place a little barrier such as a towel if needed. And we don't want to be placing it directly on the skin. Baths and showers should be comfortable. We don't want to be, again, burning ourselves. The goal is to warm up the tissue but not to burn ourselves, of course. All right, so let's talk about when ice and heat maybe isn't working and we need to start seeking some medical attention and care. So if you've noticed you really can't move it at all or bear any weight on that joint, if you have pain directly over the bones of an injured joint, if you're experiencing numbness in any part of that area, if you have symptoms that are persistent or worsen, yes, I would say after about 10 days, that's probably a little long to be experiencing discomfort, and it's time to look at some other options besides ice or heat as modalities to help treat it. Or if you just feel unsure about what's going on, always seek out medical professionals. They can help to investigate the issue a little bit further. All right, so what can you do next? So we do have some new knowledge that we've learned, right? And we want to think about active warm-ups before our physical activity. So I also like to think about warming up the body before we go into our workday and keeping the body warm during our workday. So when you wake up in the morning, some nice gentle stretches can be really helpful. A walk around the block, getting the body warm for the day, and then making flexibility a regular part of your fitness routine. We have CubeFit sessions. You can click that link right there to sign up for them. But again, keeping the body moving through the day is going to help to keep that heat and warmth in those tissues throughout the day. And then also listen to your body. If you're feeling some persistent discomfort in an area, you've been using ice or heat and you feel like it's just this continuous loop that you're on, looking at your workstation can sometimes help. You can click that link and it will email me directly. We can look at a consult or an evaluation for your workstation. And then again, if it's something that seems to be persistent, you also have access to Teladoc. You can click on that link or your doctor on demand, and you can start investigating what you're dealing with a little bit further. All right. So that concludes our session here. I'm going to actually go ahead and close out our recording, and we'll look at some of the questions here in our chat box.